Dr. Kajee is a consultant perinatal psychiatrist and director of medical education at Norfolk and Suffolk NHS Foundation Trust, with a special interest in neurodevelopmental disorders within maternal mental health. And she was key in developing local perinatal services. Dr. Kajee has been involved in teaching and education throughout her career and is really passionate about making education everyone's business. Dr. Vivek Agarwal is a consultant psychiatrist at the Norfolk and Suffolk NHS Foundation Trust and is also the core training program director. He completed his medical degree in India and got his master's degree in clinical psychiatry at the University of Leeds. Dr. Agarwal has a passion for teaching also. Again, guys, if you have any questions, please feel free to put them in the chat and we'll try and answer them at the end if they aren't in the talk. And I will let our lovely speakers take it away. I hope I got all the introduction right, and I'm sorry if I mispronounced your names.
Thank you so much. Is the presentation on the platform?
Yes, I believe it'll be up in just a second. Is that all right? Can you see it now?
Yes, I can see it. So yes, I have the slides, so I should be able to control. Somayya, are you there?
Can you hear me?
Yes.
Can you see me and hear me?
So good afternoon, all of you, and thank you very much to the organizers for inviting us and for your very kind introduction. For this session, you're getting 2 for the price of 1. I'll just tell you about myself a little bit. As Becky's already mentioned, I'm a consultant psychiatrist. I studied in the northeast of India in a college. It was called Assam Medical College. The tea garden picture is because our college was surrounded by tea gardens all around. I used to walk through tea gardens sometimes to get to college. So wonderful experience there. And I've been working in psychiatry for coming close to 18 years now, and really enjoyed my time and enjoying being a psychiatrist. I'll let Somayya introduce herself.
Hi, everybody. So my name's Somayya, and I'm also a psychiatrist. And I'm from South Africa, so that's where I was born and grew up. And I did my medical training at the University of Cape Town, which you can see in the picture, sort of at the foot of what we call Devil's Peak, down in the Cape. And I am a perinatal psychiatrist, as well as director of medical education at NSFD. Vivek and I are joined and connected by our passion for education and training. And after completing my medical degree in Cape Town, I worked there for a couple of years and then came up to the UK and completed my psych training in Norwich and Cambridge on the rotation there. I work at the moment on the mother and baby unit, but also do some community work, which we'll talk about a little later. And as Becky said, my big interest is around female mental health, particularly neurodevelopmental disorders in women, how they present differently, and then particularly around women when they are of childbearing age and having babies. Are you guys managing the slides for us, or can we move on to the next one? Are you doing it, Vivek?
Yes, you just tell me when to move.
Right, thank you. Yeah, if you tell me how to do it when you're talking, I'll do it. So I'll just tell you guys a little bit about what Vivek and I are going to do today. As you said, you're getting 2 for the price of 1. I don't know if that's a good or a bad thing, but we'll try very much to keep to time and maybe try to actually keep ahead of schedule so that there's enough time for you all to ask questions. It's really hard online, as you know, but what we thought we'll do, because you're getting towards the end of your weekend, which I'm sure has been fantastic, but you know, post lunch, that Vivek and I will interview each other and ask each other questions about our journey in psychiatry, and then through those interviews maybe try to reference some of the relevant research about what we're talking. We'll talk a little bit about training and the different options for careers in psychiatry. And I know you've had Trevor and Julian and two other South Africans talk to you about that, but we'll cover it. And I know that some of our fantastic trainees are speaking to you guys this afternoon, and we'll take it from there. What we're hoping for, Vivek, is do you know how to change? Do I just press that arrow, Vivek? Yeah, there we go.
Yeah,
okay, good. Yeah,
sorry,
I'm on it. Yeah, what we're hoping. Thanks, Julian. What we're hoping for is that maybe you get some understanding about why doctors choose psychiatry, why for most of us, if not all of us, it's not a last choice. It's in fact a first choice. What we do in our day-to-day lives, and maybe some of the difficulties facing psychiatrists, you know, in the UK, in the world, and maybe we could try to have some sort of discussion about some of those things. So I think that we're going to leave it there, and Vivek possibly has the first question, and we will get started and see how we go. Hopefully this will flow smoothly, and it will feel like a conversation or an interview between two colleagues who are interested or have interesting things to say.
Yeah. And
okay.
Okay, as you're hearing from a lot of colleagues from NSFT, there may be some overlap in what we talk about when we talk about things with you. So what we thought we'd try and do is keep it more in terms of our personal experiences, to just demonstrate what we have had, what sort of good, bad experiences we have had. So the first question, really, Somayya, I wanted to ask you, and this, despite us being colleagues and trainees together for many years, I have actually not asked about how you decided to become a psychiatrist. What was your journey like?
Yeah. I'm going to try to keep it brief, because people who know me know that I kind of can talk a lot. So if I think about it, actually, when I was at high school, I wasn't even sure if I wanted to do medicine. I'd always sort of like flitted around, and I was very chatty and very noisy. You may be surprised to hear this, Vivek. And eventually, I think one day on a whim, I just decided I was going to do medicine. And then I did my training, as I said, in South Africa. And when I finished, and when very similar to what we have here, we have an FY. We had what we called internship, and then a community service year. And for my community service year, I went to Grahamstown, which is a little town in the Eastern Cape that actually very topically was made famous by Cecil John Rhodes, who I'm sure you guys would have heard about, and there's a big university there called Rhodes University, but equally there's a fantastic psychiatric hospital there, actually called Fort England, and I did 6 months there, and during that time I also did my diploma in mental health, and it was just a phenomenal experience. You know, we were left, the medical director there let us do as much as we felt we could. My colleague and I, we ran the wards. We had a physical health ward as well, so whatever, and he said, whatever you feel comfortable doing, do. So we did, you know, it was almost like a family, because unfortunately, like a lot of the patients that came, particularly the ones with more longer term difficulties like learning disabilities or you know, severe mental illness, who just couldn't go back home, they end up living in the hospital, and we would do, you know, IV drips for them. A lot of African males in South Africa have to be circumcised at a certain age, so they were in hospital. We would do circumcisions, we would do ECT, and it was just a fantastic experience. And that's the reason. And when I came over to the UK, I just continued to do that. And then later on, I became more interested in women's mental health, and particularly perinatal psychiatry. It was quite interesting because you know, I got a very different dialogue or narrative when I'd made the decision to do psychiatry or even medicine. A lot of my high school teachers thought that I'd go to do law or something more in the sort of business or private sector, and my family were like, why are you doing psychiatry? You know, do you think it's meaningful? What about all those years? But a lot of others felt that they could understand. My one uncle told me, you're a very nosy person, so psychiatry is a really good career for you. So there we go. It's just, yeah. And you, what about you, Vivek? What was your journey like?
Oh, so I had an interest in psychology. I used to read a lot of thrillers, and I was interested in forensic psychology.
Like Alfred Hitchcock or
Yeah, I mean, I mean, reading Sidney Sheldon and all that. So I wanted to be, I wanted to become a forensic psychologist. So I actually started doing a psychology degree. But in India, there's always a pressure if you get good marks, good grades. There's always a pressure for you to become an engineer. At least it was at that time. Nowadays, it's MBA. And yeah, so I was kind of pushed into medicine. I also did have a passion to be a doctor at some point. So it wasn't like anyone forced me. It just kind of happened. But as I was doing medicine, I did my psych placement, and then through lectures, one of our professors was very influential in terms of making psychiatry so interesting. I gravitated towards it, and because of my interest in psychology, I think it was easy for me to move into psychiatry. And yeah, since coming to the UK, that's what I've done. I must say, I also the other special area of interest for me was neurology. So I've always had a little bit of an interest in neurology as well. I did some neurology before coming to the UK, and I think that's one of the things that I'm really glad that the Royal College is now focusing on improving the curriculum or adding to the curriculum in terms of neurosciences.
Yeah, no, that makes. I mean, yeah, I think it's a very interesting journey for most people, isn't it? And that sort of brain, and I also had that interest in neurology actually, and yeah, it's just really and that sort of wanting to spend more time with your patients, wanting to know them better, but also a little bit about that we don't quite know everything. And I think that was also really fascinating to me as well, that actually there's a lot more to understand, or a lot more that we can still do or discover. I mean, I want to be really funny with my cousins who are in like other family members who are in the other medical field. I always just go, oh, we don't just have a scan that we can shove everybody into, who can tell us what's wrong. We've actually got to use our clinical skills and our clinical acumen. They get really annoyed at me, but anyway, there we go. Yeah. So I think, sorry, Vivek. Yeah, I thought you had.
Oh, we're both moving. So
yeah, sorry. Yeah, there we go. I'll leave it to you.
I wanted to ask you next about as like working as a psychiatrist, what are the things that you do during the course of a day, or maybe I think it's easier to answer in terms of a week, and are there things that you do not really enjoy as part of a typical sort of working week? And then I'll come to the bits about the research after that.
Are you going to do that? Are you going to do you want me to answer that first, and then you're going to talk through the research? Yes. Okay, that's absolutely fine. I mean, my day, I mean, I work in perinatal mental health, and I think you're going to ask me a little bit more about that interface in a bit. But so at the moment, I have a bit of a split job, which is actually really, really good. So I spend 2 days of my time in the week doing the director of medical education stuff, and what that's about is just trying to have oversight about education within the trust, not just for our trainees who are, but they sort of the biggest chunk, and Vivek, you do a lot of that, but also for our doctors and for our consultants and all the other medical staff, to make sure that we're constantly learning, and that, you know, we see learning very much as being, or educating as well as learning as being, part of our job and what we do. And then the other time, I spend 2 days of that on the mother and baby unit, which is an 8-bedded unit that anybody's welcome to come visit if you're interested, where we admit mums who are in the last trimester of their pregnancy, or in up to the first year post-birth with their babies, if they're postnatal, and those are particularly for women who become very ill post-birth. And so, you know, my days will be spent, usually it's women who have developed postpartum psychosis or postnatal depression or postnatal OCD, and it will be spent sort of trying to treat the women in the in that period. And I also do some work in the community. So we have a perinatal community team who will see, again, women who have just fallen pregnant with known mental health difficulties, or whose mental health deteriorates postnatally, and we will try to manage and support them with with various other professionals within the team, some of it medication, some of it therapy. And I also do an antenatal clinic, which is a combined clinic with midwives and obstetricians at times, again, supporting women through their birth and their pregnancy. You're going to probably say the same thing about the bits of your job that you find less tedious, and I think we all will say it's just the admin and some of the form filling and those bits that take up a lot of time, that do make the job less enjoyable. But I appreciate, you can't just do clinical work. But my dream would be if I had like a scribe that was just sitting next to me, who would just type up my letters for me or put my notes on Lorenzo, which is our electronic system. So that's me. What about you, Vivek? Because you used to be the consultant on the PQ, which is the psychiatric intensive care unit based at Halston in Norwich, and you've recently moved, not only working from Norwich but to Ipswich, isn't it, into an adult community team. So that's quite a big shift as well for you, wasn't it?
Yeah,
What's
yeah.
your
And
take
I
on?
think I guess one of the things also we wanted to highlight to our audience today is, as a psychiatrist, you may wish to do general psychiatry, which means seeing common mental disorders either in a clinic or in a hospital setting. But there are also various other subspecialties within psychiatry. Perinatal has developed a lot within the last few years. But I was working in a slightly specialized area, which is psychiatric intensive care, where we used to get the most seriously unwell patients. So it was a 10-bedded unit based at Hillston Hospital. It still is. I was there till October, and I worked there for 5 years, and it was probably one of the toughest job, but also one of the most enjoyable things I've ever done. And to see our patients who came in severely unwell and leaving feeling much better, it was very rewarding. And we always used to have medical student placements, and the medical students really enjoyed their placements when they used to come to PQ, because they could, it painted a slightly different picture to the one that most people think of when they hear about psychiatry, which is patients are chronically unwell, nobody gets better. But you could see the difference timely and good treatment can make to the symptoms, to the lives of some of our patients.
Yeah.
So, and now I'm working in a more sort of typical psychiatrist job, doing outpatients clinic, seeing people with all a very wide range of mental disorders. Because whilst on PQ, it was more, I'd say, dealing mostly with psychosis and disturbed behavior, violence, that kind of presentation. Whereas now I'm in clinics seeing a lot more depression, anxiety, substance misuse, also a much bigger variety of mental disorders. And you're right, in terms of what I enjoy the most, I think if I could just do clinics and talk to patients, I'd happily do it. And it really is very hard for me to sit down and write notes and fill forms, and especially some things where I guess as clinicians we feel they don't have clinical relevance, although they are still important, so we have to do them. I think I could move on to some of the research that we looked into in terms of preparing for today's presentation. Just wanted to highlight what sort of things affect people's choices when they are thinking of psychiatry. So most of the research that I'm presenting is on medical students and how placements make a difference to their career choices or their perceptions of psychiatry. So this is a research article by Lyons et al. And they looked at what impact a clerkship had on people's attitudes towards psychiatry and what perceptions they made of psychiatry, and as well as stigma. And I must admit, these boring slides, there are only 5 of them. So, and we'll move on to our interesting conversations again.
Well, interesting for us.
So yes, so there is they found that there is a significant decrease in negative and stigmatizing views towards mental illness after clerkship. Although it seems that overall the difference still, or the score still remained close to neutral values. So maybe the impact has the impact of a clerkship or a placement in psychiatry in terms reducing stigma needs to be more tailored and to address that point in particular. Just merely people coming and watching cases or seeing the practice may not have that impact. The one good thing was that number of students who were considering psychiatry went up. So this was just kind of on a Likert scale. And if you look at the percentage figures, they usually hover between 5 to 7 to sometimes 10% of medical students wanting to do psychiatry. In fact, we were very pleased to see a few years ago, Norwich Medical School was amongst the top 10 recruiting into psychiatry. So quite positive for us in the region. And then the study also found that integration of some strategies to overcome stigma towards mental illness and mental health profession may improve attitudes towards psychiatry. So I think, again, one of the points to make is that the stigma is not just towards mental illness and sufferers of mental illness. It sometimes is directed towards the people who also practice.
Are we going to cover that? Hopefully, if we're good with our time.
Yes, if we have time, we can cover that.
Yeah.
So another study looking at factors affecting medical students' career choices, and they find that the things that influence people's career choices are their personal needs and future needs, expected future needs. Plus, when they get into medical school, they start collecting information on various specialties. And I think that has an impact on how eventually what career choices they make. And I think that's why there is, when they are collecting information, going to the right source of information is important. Then they look at the population features, the patient population features of the group that they might end up seeing within a particular specialty, as well as the type of colleagues and teams they might work with. So quite interesting, and I think that is why it's apart from the science behind the specialty, I think it is also important to highlight within teams what kind of teams they might end up working with, what kind of people they will be working with, and I think that because that does have an influence on students' choices. So this finally one more slide I wanted to show about. I used to work with Simon Bird. He was the lead at Leeds Medical School, and this was a research they carried out, and it was quite big because they managed to get over 900 questionnaires back, and they found that although psychiatry was the top choice in only 4% of medical students' answers, it was amongst the top 3 in 14% of people. And I think that's where maybe if people are keeping it as a second or a third option, those people are definitely interested, and it's about us working with those in terms of asking and trying to motivate them about what it is that might actually increase their likelihood of choosing psychiatry eventually. And students, if they had undertaken clinical placements, tended to be more positively inclined. And it was because of their having had first-hand experience, having had some feedback on. And when it says psychiatric skills, it's not about psychiatric skills as an expert, but if when you are on placement and you're told that you communicate well, you tend to understand people holistically, I think that's going to motivate somebody to come into a career like this. And yes, another paper that was published in the Psychiatric Bulletin looked at various factors that influence people's choice to come into psychiatry, and they found the top ones being job satisfaction, lifestyle and family-friendly status of psychiatry, which we are really proud of, and we really try and work hard to keep that going.
I'm just
so we've already been through the typical day.
We've covered some of these already, and I'm just going to go through, Vivek, because I'm just aware we've got about just under 20 minutes. So yeah. I'm thinking maybe we can, we were going to talk a little bit about some experiences that we've had, but I think if we move on and talk about the other sort of more challenging bits, I think, and I don't know how to go back and check the chat, but I see there've been a couple of questions on the chat, so hopefully
I'm keeping an eye on the chat. What we can do, take the questions
at the end?
10 minutes. So
okay. So we can maybe move on. I'm aware that you're going to have some talk with our trainees later, so I did prepare a couple of slides about what you need to do or how it works for training or specializing. I'm just going to leave the slide on, and you can see that that you've got your core training and higher training, and it says 3 or 4 years higher training, because certain times you can do a dual training, like either old age and adult, or forensics and adult, and that sometimes adds the extra year to your training. And we do our exams at the end of the 3-year, where you become a member of the Royal College, and then you do your next in the sort of area or specialism of choice. And as Vivek said, the main branches are sort of general, adult, old age, learning disability, CAMS. I saw there was a question about CAMS there, which I can answer, and particularly because I work in perinatal, I've got big overlap with a lot of the CAMS consultants. And then learning forensics, medical psychotherapy. General adult is sort of the biggest one, and you can get at the moment what we call endorsements, so in things like addiction or liaison, or rehab, but there are other areas, and as we're progressing, we're seeming to some seem to work a bit more specialized, so that somebody might only work in eating disorders or in perinatal, like myself. The GMC, I think, brought out a document called The Shape of Training, where they were trying to reduce the number of sort of super specialisms in all specialities, and wanted us to be more generalist, and they were trying to reduce the sort of number of specialists in psychiatry as well, and brought in this thing called credentialing, which you may or may not have heard of. So at the moment you can get a credential in liaison, and I was part of the pilot for perinatal, so you could do a bit of once you're qualified, and as a consultant or when you're in training, you could work in that area, get a bit of expertise, and then get a credential in it. So that's where things are headed, I think, for most areas of medicine. And what do we do? I mean, a big part of what we do is listening to our patients, and constantly assessing, and our mental state. I mean, we do an examination, and our mental state is a big part of that examination. It's been trickier during COVID, but and based on all of that, we use our clinical skill and our acumen to come to a diagnosis, and then discuss wider management and treatment with our patients, and a lot of time that's working within a team with lots of other professionals with their expertise. We don't just diagnose and prescribe medication. So it's quite a lot. A lot of it's providing that thought and that thinking around particularly complex scenarios, and bringing that sort of oversight, which I think is the most useful thing that we can do as psychiatrists. We take from everywhere because of the way we've been trained. We've got that basic medical training, and then the psychiatry training on top, so we can pull from all of those reserves. And we do, I mean, particularly myself in perinatal, and the hilarious thing is, when I was deciding to specialize, I was like, I'll do any area besides obs and gynae, and now it's such a big part of what I do every day. But we do see the person as a whole, and our patients, and unfortunately it shouldn't be this shouldn't be the case, but it is the case. We are more, our patients are more at risk of things like obesity and smoking, and lack of exercise and poor diet, and all of those things. So we've got to be thinking about that all of the time. And as well, we're responsible. We need to think about the effects of our medications when we're prescribing. But there's so many benefits. It's so diverse. You know, we have lots of choices, and I think the biggest plus is our patients and the richness that they bring, and how we can learn always from what they have to offer us, and just by being there with them through the difficulty, and then when they get better. So Vivek and I were going to talk to you a little bit. I put the struggles up here, but you know, it's just about the issues or the things that we feel are facing us, maybe as psychiatrists at the moment. And Vivek, I mean, I know you were going to ask, or we were going to chat a little bit, and I think maybe I was going to ask you about what you thought, or one of the big things you wanted to talk about at the moment, and we can have a discussion about that.
Yeah. So I think it may be also a good time, because we got some questions in between. I think a couple of students have mentioned about them having the same thing about parents telling them it's a waste of all those medical years. And yeah, I think we do sometimes hear that to chain and say, make sure that it doesn't really. It's good to educate people and say that's not really entirely the case, but also at the same time, I think we, to some extent, in the West, psychiatry itself has actually moved away from medicine or medical specialty physically, in terms of being in different hospitals, and the training, even the training being so detached from mainstream medical training. I think it does create that sort of slight divide, and I think through the introduction of neurosciences in the curriculum, that's one, in terms of maybe trying to make sure that doctors who are coming into psychiatry have a more fuller knowledge of physical and mental health aspects. I
was going to ask you a little bit, working on the PQ, we were going to talk a little bit about the Mental Health Act, which is another area that we sort of face, and about that a little bit. Or was there another question that you think we needed to answer?
So
because I can't see them. Apologies. I'll try to see how to do it.
There was a question about, my parents have had concerns as I'm a person with lived experience.
Right.
I think that's something really crucial, important to understand. And just I was talking to one of my previous medical students. So he'd done an elective with me, and he texted me a few days back and said he wanted to talk to me. And in his case, he's doing foundation training, and his foundation tutor actually said, "Are you really sure that you want to go into psychiatry?" Because he's had some mental health difficulties of his own. And my answer to this is really yes. You talk to somebody that maybe talk to a psychiatrist, somebody you have worked with, somebody you have done a placement with. Try and understand the nature of your difficulties, because in some cases, if you have difficulties that you think might come in the way of you either delivering the best quality care, or the care that you provide, or your day-to-day job might actually have an influence on you, it needs to be thought through, and what support you might need, what kind of support during training, and how to make sure that the work is not impacted and the work doesn't impact your mental health. There's no simple sort of straightforward answer here to say that people with lived experience should not do psychiatry.
Exactly.
They can actually bring a lot into psychiatry.
Yeah.
We have a number of psychiatry colleagues, consultant psychiatrists, who have had lived experience, and I know that it actually adds to the provide.
Yeah, I couldn't agree more. I mean, I think we have our trainees, we've got colleagues, and I think it's definitely not a hindrance. We just need to be aware and put in reasonable adjustments. And as we would do for anybody, you know, if you had diabetes and you needed to have insulin at work, you know, that's what we would do. And I think, yeah, I can't stress more strongly, please don't let that ever hold you back. And just think, I mean, and I know that Ahmed spoke to you guys anyway at some point today, but think about the impact and how you can change the narrative for people who struggle with mental health by being in the field itself. Yeah.
Okay, so Somayya, you asked about the challenges, and I think I was mentioned the Mental Health Act. I mean, with the Mental Health Act, one of the issues being court practice, and it's just important to understand for us that we have the coercive practice tends to be a bit of a contentious thing. It's often highlighted in the media as an abusive practice, but on the other hand, there is also a duty for us to manage patients' risk to themselves and others. So I think that's it's something that does come up often in discussions, and what we want to do as psychiatrists is keep our practice minimally restricted and make sure coercion only takes place when it is absolutely necessary, when there is no other option, in order to make sure that we are safeguarding the patient and their environment.
Yeah, I mean, we've
You
touched
wanted
on
to say about stigma.
Yeah,
Sorry.
we've touched on it, and this thing about stigma in psychiatry is just so huge. Just like, again, I saw Julian posted about if I had a fracture, can I do orthopedics? And the fact that we question, I've had mental illness, can I be a doctor? Can I be safe? Can I practice? Can I do psychiatry? And the saddest thing is that the stigma isn't just from outside of psychiatry or outside of medicine. The stigma we face is from within medicine, and even from within psychiatry itself. And I think to a lot of people that's something that puts them off wanting to do psychiatry. And I say to those who are interested, see it as a challenge, see it as something to motivate you and to step up to say, you know what, I'm a psychiatrist and I'm proud of it. I've had lived experience and I'm a psychiatrist and I'm proud of it. Because the only way that we're going to tackle the stigma, and I've put up some slides as we've gone along, I've not referenced them, but it's just again highlighting some of the stigma and some of the reporting in the media and some of the biasness that we see. And Vivek's going to link this into social media and how psychiatrists copy it a lot on social media around prescribing as if that's the only thing that we do. And in perinatal as well, my women are like, oh, I'll just push through, doctor, or like, do I really need to take this drug? And I was like, would you ask the same question if you were taking medication for your hypertension? Would you think about, oh, I'll just push through for my baby, or and it's in the narrative, and it's that unconscious bias. And I'm sure all of us had said, or somebody has told you at some point in your career, well, oh, you're too good for psychiatry. Why are you wasting? You're so smart, or you're so intelligent. And I keep saying, there's so much we don't know. There's so much that we can do. And again, I don't have a scan, and I'll sometimes tell my patients I don't have a scan. So sometimes I'm going to get it wrong, but I'm going to try my best. I'm going to work it out. I'm going to listen to what you're saying. I'm going to think about what I know, and together we're going to see how we can come to a diagnosis or an understanding about what your difficulties are and contextualize it for you. So that is something that will always be there. And just think that every time that you step out, you are the face of your profession, and to wear that with pride. Okay, I'm going to stop lecturing.
We've only got 5 more minutes. So
yeah, and you wanted to talk about
there are a couple of. I'm sorry, there's a couple of questions. I'm not going to dwell too much on social media. You guys have access to social media. Go and have a look at Twitter. Go and have a look at Psychiatry.
Yeah. I purposely didn't say service user at all today, Vivek.
This was for example, I mean, I spend maybe an hour or two every week, and most of what I do on Twitter is trying to dispel some myths, and sometimes I get arguments with people with ill-informed views, stigmatizing views, people anti-psychiatry views who do not understand the science. They're very ideological in their stance. So anyway, please have a look. There are some good people to follow. I mean, these Aves and Wendy are the people that I have enjoyed. They're very because there are lots of polarized psychiatrists as well. But these people are generally quite balanced in the way they communicate generally, so quite good. And Yes, and just again, how media also has an impact. I mean, this story about Prince Harry opening up about his mental problems has had quite divisive. Somewhere it has been good, but there are people criticizing about him being a hypocrite and all sorts of things. So it's just important to make sure when you see something even in the media nowadays, it's easy for us to comment and challenge any sort of stigmatizing views. What I will do is quickly, there is one.
I've worked out how to use the chat function, FYI. Every day is learning day.
There's a question about climate emergency. One about the experience of working in camps. I just briefly touch upon camps and just say that camps there has been a lot of difficulty recruiting into camps. So camps is suffering from a huge recruitment crisis, which is why working in camps has become very difficult. Somayya and I don't work in camps, but surely if you are interested, there may be camp psychiatrists that if you're having a placement within NSFT, that camp psychiatrists will be happy to talk to you about their career.
Definitely. And HE are well aware about the recruitment difficulties in child and family as a whole, and are going to try to do quite a lot to encourage students to do camps. And we've got run-through training as well, haven't we, for camps at the moment?
And I just wanted to congratulate Jack. Good question.
Fantastic question.
It's something that's going to take a lot of time, but yes, it's good to see commitment towards climate as well. We all should have, and as people of science, I think one of the advantages we have is in promoting the right sort of evidence, challenging people's pseudoscience in terms of all these things like climate change.
Can I say one thing that I've done about climate change, Vivek? I am lobbying to have car charging points at Helston Hospital for those with electric cars, because we don't have them at the moment. And you may giggle, but the delay at the moment is that they don't know which department it sits under.
And
or is it maintenance? I don't know. But
another interesting point is one of our colleagues is a member of Extinction Rebellion. So really hardcore into climate change science. And right, one more minute. I don't know, Tori, if there was anything.
Sorry, it's so rushed.
That was great, guys. I think you answered all the questions that we had as you were going. Let me just get my camera on. And yeah, as you guys mentioned, we've got some of the trainees joining us in about 45 minutes, I think, for a little panel discussion. And the great thing about them, they're all doing kind of different subspecialty training. They're all at different points in their training as well, through from core training to like nearly finished with their specialty training. So that's going to be really great for anyone that's interested in psychiatry to hear a little bit more about kind of from now where we are to kind of getting to where these guys are. But you guys definitely promoted the hashtag choose psychiatry. So
and I just want to say, you're welcome to contact myself. We very sillily didn't put up our email addresses, but Tori, you have it. So, do contact us. And we'll be very happy to talk with you again or catch up with you or anything.
Great.
I mean, I know you guys have Julian as well, so yeah.
we do have.
And you have our Twitter handle, so feel free to message us there.